So the other topic is venous thromboembolism. So it is also called as VTE. So venous thromboembolism. What do you mean by thrombus? Thrombus is nothing but clot formation. Venous thromboembolism. That means formation of thrombus or embolism in the venous circulation. That we call it as venous thromboembolism. So it is characterized by the formation of thrombus in the veins. So it is called as deep vein thrombosis and pulmonary embolism. So it is characterized by two things, that is DVT and PE. DVT is nothing but deep vein thrombosis and PE means pulmonary embolism. So what do you mean by thrombus? Thrombus is nothing but clot or mass which is formed due to formation of blood clot and other fat deposit cells, and all together will form a thrombus like thing. So when this thrombus gets accumulated or settled in the deep veins of your legs, most commonly, then we call it as deep vein thrombosis. And then when this thrombus or the clot which it is there, which is formed, if it gets dislodged from that location and moves into a systemic circulation and passes through the pulmonary veins and arteries, then we call it as pulmonary embolism. Pulmonary embolism is a very fatal condition. If pulmonary embolism occurs, patient dies within few minutes. And then coming to the pathophysiology. So before going to pathophysiology, we have to know what was a normal hemostasis. Hemostasis means what was the process which helps in the normal regular flow of blood in the circulation. That we call it as hemostasis. That means if there is an injury happened, then it causes bleeding. When the bleeding happens, our body, what does it do? It will do a response to stop the bleeding by forming a clot. And then continuously forming clot is not correct. So it has to be stopped at certain point. Again, then it stops, and then the process will be maintained in that regular manner. That we call it as normal hemostasis. That means which will secure the normal systemic blood flow in the blood vessels. So it includes mainly it includes clotting process, that is coagulation process, which helps to seal the injury by activation of activated platelets, clotting factors which will get activated and cause the formation of a fibrin clot. In contrast to this physiological hemostasis, this is a normal hemostasis, that is physiological hemostasis. So in contrast to this, there will be pathological venous thrombosis will be taking place. That means even though there is no vessel or wall disruption, or even though there is no injury to the vessel wall, it starts formation of it starts activating this coagulation cascade and it will trigger the formation of clot. So that we can see in case of pathological condition, that is DVT. So it is triggered by certain microparticles which are having the tissue factors rather than which is not generally expressed in the vessel walls. So it is of three different types, like idiopathic, that means 50% of the cases are idiopathic. That means there is no proper reason why they are getting with this DVT or VT, that is vascular thromboembolism. And then hereditary thrombophilia, like where there is hereditary or genetical changes in the clotting system or the clotting factors, like factor V Leiden, protein S or C deficiency, antithrombin 3 deficiency, polymorphism in this, dysfibrinogenemia, homozygous homocystinuria, rare mutation. So these are the hereditary conditions. And then acquired causes include secondary to cancer, like ovarian cancer, colon cancer, lung cancer, mammary glands cancer, and then brain and pancreas. So any cancer, so secondary to that, there is a chance of getting this DVT. And pregnancy and use of oral contraceptives, secondary to hemophilic treatment like F8 elevated, and secondary to chemotherapy, use of central venous catheters. Central line will be placed in case of any emergency conditions. And secondary to hip arthroplasty, like hip surgeries and surgery or major trauma, or home nursery, that means immobilization for longer duration if the patient is bedridden, like in case of a CVA, or in case of any comatose patients, or elderly people who are bedridden. In that conditions, they are at risk of getting this deep vein thrombosis, because in that condition there will not be proper or free flow or proper circulation will not be taken place. So as there is no proper movement of blood, it leads to formation of small clots. And the long hospitalization time, So in order to prevent that, they will be placed on an alpha blood, which is continuously floating like thing of blood can be seen, that is used, or use of DVT stockings are also used. And in order to prevent this formation of in order to prevent this DVT, and then long travel and acquired blood conditions like antiphospholipid antibodies, anticoagulants, anticardiolipid antibodies, thrombocytosis, heparin associated thrombocytopenia. So these are the acquired blood conditions which will cause this. And those the patients who are at risk of getting VTE, it includes like age greater than 14 years old and have any one of these like immobility, orthopedic surgery, spinal cord surgery, previous history of thrombosis, pregnancy, using any oral contraceptives, acute infection, burns, obesity, disorder associated with thrombosis like inflammatory bowel disease, nephrotic syndrome, sickle cell disease, lupus, diabetic ketoacidosis, that is we call it as DKA, and say central lines, acquired or inherited thrombophilia, family history of thrombosis. Like if their father is having a risk of having this history, then they're immediately next to that their kids will be having less than 40%, that is first degree relatives. And depending on the these factors are again classified into three types: strong, moderate, and weak. So these are more at risk, like fracture of pelvis or large bone fractures, hip or knee arthroplasty, major surgeries, major trauma, spinal cord surgery. So these are at high risk of getting this VTE. And these are the moderate risk, and these are the weak risk of getting this VTE. So depending on the risk, we have to do certain precautions, or we should follow some remedies in order to prevent this formation of VTE. So coming to pathophysiology, as I said, that it's a pathological condition in which even though there is no damage to this blood vessel wall, whatever the tissue factors bearing cells which are generally not present in the vessel walls gets activated and will stimulate the formation and will stimulate or activate this coagulation cascade. So first, whatever it will do, the tissue factors, the platelets gets activated. So when these platelets get activated, they leads to the formation of thrombus. So the formation of thrombus can be seen by two pathways. First is exposure of blood to subendothelial collagen after vascular injury. So when there is damage to the vessel wall, so whatever the blood is there, when it gets exposed to subendothelial collagen, then it will start this cascade. And thrombin generation by tissue factor derived from the vessel wall or in the blood. So whatever the tissue factor which is present in the vessel wall, that will activate the formation of thrombin. So these are the two methods like how these platelets get activated. First is when there is damage to the vessel wall, when the blood directly gets contact to this endothelial collagen, then it will activate this coagulation cascade. And then the other is whatever the tissue factors which are present in the vessel wall, they will activate the generation of this thrombus. So whenever this platelet thrombus develops, whatever the platelets that got activated, they will recruit unstimulated platelet activating releasing adenodiphosphate. Like ADP will be activated, like will be segregated, and then calcium ions, and then P's, and then addition molecules. All this will together forms a molecule like thing, or micro particular like kind of thing will be formed. So when this gathers together, whatever the tissue factor it is there, it will get activated and will stimulate the formation of fibrin clot by a coagulation cascade. And then the tissue factor pathway triggers the second pathway triggers coagulation by generating small amount of thrombin. Like small amount of thrombin will be released in the second condition. So in this, whatever the thrombin that is formed, it will help in the conversion of factor 8 and 5 to their activated forms like factor 8A and factor 5A. So which then, so whatever these factors, activated factors are there, they will stimulate the teenase and prothrombinase complexes to generate large amount of this thrombin. So in case of secondary, that is tissue factor pathway, only small amount of thrombin will be formed. But this whatever the thrombin which is formed, it will activate or it will help in the conversion of factor 8 and 5 to 8A and 5A, and which then combines with this teenase and prothrombinase and resulting in the formation of large amount of generation of large amount of thrombin. So finally, large amount of thrombin is produced. So this thrombin will help in the conversion of fibrinogen to fibrin monomers, so which helps in the formation of fibrin strands. And also factor 13A covalently binds these strands together. So fibrin deposition will be seen like a mesh-like work can be seen. So This is the thing how it will seal the vascular injury and prevents the blood loss. So generally whatever these things happens, once it reaches certain point and once the sealing is done, then again antithrombotic substances will be released by this endothelium, which will dissolve this clot formed. So it will be done with the help of certain molecules like thrombomodulin, which will convert the protein C and S to their activated forms, and then which will inactivate this factor 5A and factor 8A. So once these were inactivated, they will stop the formation of thrombus. So in this way, this has to be happened. But in case of VTE, whatever the things like whatever the antithrombin substances are there, they will be suppressed so that antithrombotic action will not be taken place. So whatever the clotting thing is going on, that will be continued for a longer duration, leading to the formation of thrombus. Okay. And also the fibrinogen, generally what was when plasminogen should be will be released in order to convert plasmin. So this plasmin will degrade the fibrin mesh. So this also will not be taken place. So it will inhibit this plasminogen also in case of VTE. And then alteration in the vascular injury occurs within trauma. So these are the conditions where we get these things. So this is the flow chart. So this is the thrombotic things, and these are the antithrombotic factors, or these are the inhibitors of this clot formation. So when there is vessel damage, so tissue factors, collagen, when they gets exposed, they will release certain thrombin. Platelet thrombus gets activated. Coagulation cascade will be activated by by conversion of factor 5A and 8A to their activated forms, and thrombin will be formed. So this thrombin will help in the conversion of fibrinogen to fibrin. So this fibrin will be formed, and then in the presence of factor 13A, fibrin will be stabilized to stabilize the fibrin clot. And then here what will be there? Till here this is the formation of clot will be seen. And then now antithrombotic or inhibitors, once the vessel wall is sealed, then this plasminogen activator which is there, it will inhibit the dissolution of that. And but this will be inhibited by alpha 2 antiplasmin and antithrombin, heparin, thrombomodulin, protein C, protein S, tissue factor pathway inhibitor. All these will get converted to activated forms and inhibits these following steps. But in case of VTE, these will not be taken place. Only these things will be continuously going on. So the only clot formation will be taking place, but sealing will not be, but stopping or there will not be stoppage or inhibition of this thing. So continuous formation of that thing can be seen. So when coming to this is the picture showing that these are the deep veins of legs. So this is a normal blood flow. These are the valves which helps in the easy flow of blood. When coming to deep veins, so here there is formation of thrombus. So once there is formation of thrombus, and when this gets dislodged and this thrombus when moves into circulation, then this we call it as embolus. So in case of DVT, we can see the superficial veins which are dark or black in color, which indicates the presence of veins. How a pulmonary embolism occurs. So we can assume this as a thrombus in the deep veins. So blood clot, when it starts moving into the circulation and enters into the pulmonary vessels, it causes pulmonary embolism. Clinical presentations include, the symptoms will be like unilateral leg swelling, pain, tenderness, erythema, and warmth only in the leg, which in where there is formation of thrombus. At that only we can see this leg swelling, pain, and tenderness can be seen. The signs include palpable cord, that means vessel can be palpated with our hand, and a positive Homan sign can be seen. And symptoms of pulmonary embolism includes cough, chest pain or tightness, shortness of breath, palpitations, hemoptysis. Hemoptysis is nothing but expelling blood from his mouth and nose, and dizziness and lightheadedness. And signs include tachypnea, tachycardia, diaphoresis means excess sweating or profuse sweating, cyanosis, bluish discoloration of these peripheries, hypotension, decreasing the blood pressure, shock, and cardiovascular collapse. So this is very severe condition, which is a fatal, we cannot control, we cannot manage it. And then post thrombotic syndrome, it includes symptoms like chronic lower extremity swelling, Pain, tenderness, skin discoloration, and ulceration can be seen. Diagnosis. So first we have to focus on the risk factors like age, whatever the risk factors we have discussed, like strong, moderate, and weak. So depending on that, we have to check these risk factors like previous history of VT, trauma, malignancy, hypercoagulable states, or use of any drugs, therapies. And then we have to, once we have discussed these, identified these risk factors, then we have to go for radiographic contrast studies depending on the signs and symptoms and risk factors, and then we have to go for radiographic studies. It includes venography and pulmonary angiography. So these will helps in the identification of thrombus. So these are the most reliable methods. And then non-invasive tests include compression ultrasound. So under compression, they will do this ultrasound scanning so that these veins can be easily visualized. And CT scan, ventilation perfusion scan, so these are often used for initial evaluation of patients with suspected VTE. And then also there will be D-dimer levels will be elevated. When there is tissue destruction, these D-dimer levels will be elevated. This can be seen not only in thrombosis but also in other conditions like infections and inflammations. And trauma, pregnancy, cancer, in that conditions also D-dimer levels will be elevated. And a negative test can help exclude VTE, but a positive test is not exclusive evidence of. If D-dimer levels were not elevated, we can skip. We can come to a negative. It will be like negative test for the VTE. But if it was found to be positive, we cannot directly conclude that it is VTE. Again, we have to go for these radiographic contrast studies, and then clinical assessment can be used. So determine whether the patient is at high risk or moderate or lower risk of getting this DVT or pulmonary embolism. So this is how we do diagnosis. So this is all about diagnosis, signs and symptoms, and pathophysiology of VTE. And